we have Sean Rose talking to us about the stories making the news this week. Sean, what's up?
Greetings, Edgewanka. Greetings, viewers. The officials at the National Health Insurance Office, the NHI office, say the NHI plan has gotten off to a solid start, a good start. As of January 14th, we are told that some 33,000 people were already registered, and I'm sure you're contemplating in your minds that given the fact that hundreds more have been registering since January 14th, even to this very day, that figure has easily surpassed 33,000 people. It's a census by itself, and I'm sure as we go along, we're going to get some more precise numbers. Of course, registration is ongoing as the deputy in charge of the Social Security Board responsible for NHI, Mr. Roy Barry, says, of course, you would understand that people are coming into the territory for employment, and there are people I believe are returning from vacation and so forth as well. And there are some people too who may probably have missed for one reason or another the registration period, which actually closed, the official registration period, which closed on January 31st. Nevertheless, no figure has been given yet as it relates to where we are now in February, but I'm sure we can get that figure as we move along. Now, the NHI, they have already boasted that they paid out contributions to local health care providers as well. They actually paid the healthcare providers for providing the service under NHI, something that they had assured local healthcare providers during the leading up to the January 1st official start of the plan. And they have also indicated that a number of registrants under the plan are already receiving their benefits, their claims are being paid out and so forth. So we can easily say the plan is working, and not without teething issues, I'm sure, because as you will hear coming up, some folks still have some concerns. There are some questions still yet to be answered for whatever reason, and one gets the impression that more information is needed to really help the population fully embrace the plan. No indication has been given about how many or how much money has been paid in by employers and the extent to which we are seeing this level of compliance by employers with respect to paying NHI contributions that were deducted from their respective employees. The plan is expected to generate over $74 million annually, and that figure is likely to grow as we move on based on the projections given by the Social Economic Unit there at the University of the West Indies, the Health Economics Unit to be more precise. So, Edgewanka, it's easy to say so far that the NHI is moving along smoothly, and as we expect, it should be a sustainable plan. The extent to which it is managed properly would, of course, determine how sustainably it is in the years to come. But before we get into the discussion, very quickly, let's hear Courtney De Castro relay some concerns via the JTV's Speak Your Mind program aired on January 30th.
Another text came in and said, I use my NHI card at local business place, and I have found that they themselves don't know exactly what the NHI covers. The person who dealt with me made me pay in full from my pocket for the consultation after I told him that I was using my NHI card. After reading the NHI benefits package, I realized that NHI covers 50% towards the eye consultation. I brought this to their attention and they refused to refund my money, when obviously it was the person's fault for not using the NHI towards the consultation. I think you have a good case. I think you have to go take that up with the NHI.
I think the insurance rating I have, right?
Yes.
Me against I give up, right? But I have 3 children covered since September, right? The first one, she really get her care yet, but I think I bust in my brain to go down wrong there every minute. She's a special needs child. She lives here in the BVI.
Okay.
Even that, I went to the hospital with her. I didn't even get a care. what I want to do when I have to go back.
But you got her registered already,
Yes, she covered.
and you have her number.
Right now,
If you have her number, you can use her number without a CAD.
So as you notice there in that particular clip, Edgewenka, you get the impression that some folks still don't really have a full grasp of what they need to do. And for the most part, the best place to get that information from, if you can't access the information online, or consult with someone who is in the know, is to visit the office. It's a very small space. I've heard the officials there say it's challenging to be dealing with so many people. As you heard me say a while ago, over 33,000 people so far have passed through the offices there for one reason or another, getting their photos, getting registered. And so it could be very frustrating for many people. A fight ensued once just recently outside, as many people were I suspect, wrestling for numbers and trying to get at the top of the line and so forth. So it has been a very trying moment, I can suspect, for people and the officials at NHI.
Yeah, it has some growing pains, I suspect, some teething pains. It's still a baby. I would have thought that persons who are healthcare providers would have briefed their personnel on the procedures, because certainly they would know the procedures.
I think some have. Just today, I went to Smile Dental, to be specific, to get some service there, and the cost of the service rendered to me was in excess of $200. And when we applied the 10% rule under NHI, I only paid $27, and I was a very happy man walking away to a very big lunch. Because certainly that means savings for anyone going into a particular healthcare provider and getting that kind of service. And the level of service rendered in terms of the professionalism and the awareness from the young lady who was there, young lady George, it was really fantastic. So she was able to answer some questions that I had, even though I knew some of the answers, and it was pretty good.
But I think some information needs to come out to guide the people who are accessing care as to what they need to know for themselves when they go into a healthcare provider. For example, there's some questions that could be asked. Are you a part of the network? Because if you're part of the network, then the beneficiary will only pay 10%.
Right.
Co-payment plus whatever additional charges.
Yes.
And then you need to ask what NHI is going to pay
Yes.
for this service.
Right. What NHI actually covers
what-
specifically, and to what
yes,
extent.
and how much you are going to charge,
Yes.
so that you can know how much additional charges you may have to pay.
Yes.
Because your copay would be the percentage of what NHI is going to cover.
That's right.
Plus whatever additional charge above what NHI is going to pay, you would have to pay that as well. So you need to know that. And you also need to know that you have a choice. If you, and I think healthcare is becoming a situation now where you can shop, where you shop around for health services.
Yeah, some 22
Yeah.
local healthcare providers have already signed on to NHI,
So
a
you-
very significant number.
So you got to get in the habit, as you would do for anything,
Yes.
seek out the best price and the best service. So for example, you could get on the phone and you can call up and say, I need a checkup, for example. How much is your basic checkup? And then you can find out how much NHI is going to cover for a checkup, and how much additional you would have to pay so you could find out the cost. And then you could then call somebody else, another provider, and get a competitive bid, so to speak.
Yeah.
And then you could make a choice to go to whoever you want, or you could go to the
People's Hospital.
the HSA clinics,
Okay,
which
yes.
is absolutely free.
Yes.
There's no copay, and the HSA takes whatever NHI will pay. So there's no additional charges. So you can go to the clinic and get free care at the clinic, or if you have to go to the hospital, it's only 5% copay, and of course there's no additional charges.
Right.
So you have the choice, and I think something needs to come out in the public that tells the people on a mass level that
Yes.
this is a procedure that you need to follow to protect yourself from paying more than you have to, or to get the best price and the best healthcare service for you.
And
So, you
certainly,
know,
apart from what we're doing, we have always said this: given the nature of the plan, the fact that it is new, and in any event, new or not, people need to have information. They are much more informed. They can act. They can make informed decisions when they have the information, and therefore there has to be a sustained communication mechanism reaching the people consistently, because we can't assume that everyone knows. As I indicated earlier,
Right.
people are coming to the territory every day in some instances to take up jobs and so forth, and to them NHI will be a completely new phenomenon.
and of course there needs to be a line, some sort of a line of communications, whether it's a dedicated telephone line, what have you.
Well, I can tell you the staff over there is exhausted already, you know.
Yeah, I know.
Yes.
Where you might need to have additional staff.
Yes.
Where a provider, a receptionist in a provider's office will be able to call and get some information quickly. Because, you know,
So
you have to-
a hotline pretty much, something
yeah,
to that effect.
But you have to, you know, if you're
Yes.
a provider, you have to study the package.
Yes.
You know, you have to be aware of
The
all-
healthcare providers, you mean?
Yes, the healthcare providers and the
Well, the public as well, everyone.
The public as well.
It's everyone's business.
Everyone needs to know what is covered,
Yes.
to what extent it's covered, and then you can find out what additional charges the private provider might want to charge. So you have to be up on the cost of your healthcare. One of the stated goals of NHI is to attempt to reduce the cost of healthcare in the territory,
Yes.
because we know that cost continues to escalate, and how we manage that is and manage the cost reduction is going to have to be through competition. You know that we got to have the private providers compete with each other for the market share, and we're going to have the health service authority provide quality care, so that those persons who cannot afford additional charges can be assured that they're going to get quality care through the Health Services Authority.
And that's a good point, because as it relates to quality care, you don't want quality care becoming monopolized. So you have one or two healthcare providers in whatever discipline providing top-notch service, and others are not. Certainly, as it relates to People's Hospital, they too have to provide that high-level, high-standard
Yes.
service, so that the bar is raised above the let us say what is accepted to be normal. Raise it above that, so we know that the quality of service in the territory is excellent, and you reduce the need for folks to travel overseas to access services, except it's in cases like we were told earlier today by Mr. Roy Barry, that some folks have already utilized the air ambulance services and have gone overseas for treatment. But I'm saying in other instances, you know, normal checkups and so forth, no, there's no need for that. Another issue, of course, is that troubling concern about privacy and maintaining that level of patient privacy, making sure that people's information are not compromised and so forth. So the level of professionalism is really, it cuts across the board. It's not just about the level of healthcare service provided, but the entire gamut, pretty much, as it relates to providing service.
One good thing now, Sean, is that the technology provides for better privacy and better information security.
Yes.
Because, for example, a person that goes to a reception area with their NHI card, the receptionist or the person who is taking information can only access the person's record on a certain level.
All right.
So they will just be able to access the person's record in terms of their name, address, and social security number, and those kinds of that type of information.
Right.
Treatments and illnesses and all those other more private matters, only doctors and nurses on certain levels will be able to access that information, and the technology provides for that level of security. So I think that you know, that the notion that your business is going to be put on the street will soon be dispelled. Based on, you know, the level of technology that's now in the hospital.
Right.
The computer systems and the computer systems in NHI are modern, cutting-edge technologies that provide for these levels of security. So
And again, a need for consistency as it relates to what we're doing here. folks have to remove that fear of appearing in public and addressing these issues if in fact there is a fear, in a similar manner like you just did. Explain to people how their information is secured and build that confidence and remove the myths, dispel the myths pretty much.
I think in the not too distant future, in a matter of weeks, in the weeks ahead, you will see more information coming forth regarding the packages, regarding the procedures, even regarding the image of HSA's services, the clinics and the hospital, and talking about the additional services that are there and the quality of care, the quality of doctors and nurses, and and those things are going to begin to start speaking for themselves. So
I don't know if you're speaking prophetically or if you have some inside information. I may need to interview you soon.
Well, it just stands to reason.
Yes.
It stands to reason that those things are necessary.
That's
and those
right.
things will have to happen.
Yes.
But
So,
it has started out on a good note, and I'm looking forward personally to accessing care.
I was about to ask you that. Have you used your card as
But
yet?
I haven't used my
Oh,
card
come
as
on,
yet.
man.
But every 4 months,
Yes.
I get my teeth cleaned
Yes.
by my dentist, and I usually pay a reduced rate of, it's usually for $106, but I get a reduced rate of $72 because of the regular intervals in which I get my teeth cleaned.
Yes.
And I'm looking forward to paying
Even
instead
less.
instead of $76. I'm looking forward to paying $8.
Yes. Yeah.
So that's going to be a thrill for me personally. So I think NHI is going to be a really good thing if we manage it correctly, if we pay close attention to the economics of it, and we invest the money wisely so that the income can grow. We will have increased levels of care, better quality care in our public and private facilities, and have with the prevention component of the
Yes,
national
in
health
terms of non-communicable diseases.
yes, the national health strategy.
Yes.
I think we will become a healthier population, increase productivity, better quality of life. We're on the way to becoming a healthy Virgin Islands, I think.
Well, communication is key, and while much of these things are in the pipeline, I think it will be very useful for the respective officials to build that rapport with the community and really keep the lines of communication open.
Well, Sean, thanks for that report.